When I think about some of our successes, many of my patients come to mind. One of them is a 33-year-old gentleman who was working as a landscaper and experienced a large piece of equipment rolling over his foot, causing a crush injury. He had multiple fractures of his metatarsal bones, and when he saw our trauma surgeons, actually was already healing, but still had significant sensitivity, pain, and an inability to put weight on that foot. When we examined that extremity, we could see swelling, redness, and sensitivity to light touch that really wasn't going away after his fractures had healed. He was referred to my partner, who offered the patient, after a discussion of the various neurostimulation options, a percutaneous peripheral nerve stimulation, thinking of starting with something minimally invasive that didn't have a long-standing implant associated with it because of the patient's age. The patient experienced some pain relief, and unfortunately the functional improvement was only lasting while he had experienced the peripheral nerve stimulation. When the electrode was out, several weeks later, his pain returned. That patient then was actually referred within the practice to me for consideration of dorsal root ganglion stimulation. When we first planned his case, his pain was really located in his toes, as was the swelling. And he did have some lateral leg symptoms, but they were a little bit less of an impact on his function. We trialed him with a single S1 lead, and he had 80% relief at the end of his trial, and was very excited to proceed with his implant. Upon discussion, some of his pain in the lateral leg was then actually functionally limiting after his toe pain was resolved with the S1 stimulator replacement. So at implant, we decided to actually add an L5 lead as well. And those two leads provided the patient at the 30-month follow-up, after he had recovered and healed from the procedure itself, with 100% relief. He just had his 1-year follow-up, and he still has no pain in that extremity after a crush injury. His family is over the moon with the results, as is he. He's returned to work. He's living the life that a 35-year-old should be able to live.